Little did I know that my entire staff had something that they called Dr. M's witching hour. That calm demeanor under that white lab coat and those sexy high heel shoes. Around 2 to 4 p.m., I had a visible personality change known officially in medical terms as being hangry. They would call a full-on code brown in the clinic, not because I'm a brown girl, no, because they knew it was time to bust out the emergency chocolate. And I knew I had pissed you off or you were a hater if you were like whipping out the old Halloween candy, you know? And so I would eat chocolate and you're like, well, Romie, what was the problem? Well, you know, getting fed chocolate for a living, it meant in 4 years as faculty, I went up 4 dress sizes, no exaggeration. And the stress started to get bad and I was having chest pain and I was responsible and I went to the doctor and they were like, you're type A personality. Any other type A personalities in the room? You have heartburn. Stop the chocolate, take some antacids. I stopped the chocolate, got crankier, hangrier, took the antacids. I didn't get better. I went back on the chocolate, right? And let me ask you this. Has anybody ever craved arugula or celery when they're stressed out? Anybody? I do this for a living, and I ask this question, and only once in a tech audience did a young gentleman raise his hand and said, excuse me, Dr. Romie, I crave carrots when I'm stressed out. Could you tell me the brain science behind that? And I stood stumped on the middle of stage, in the middle of keynote address, and I took a breath and collected myself. I was like, you eat carrots? He was like, yeah, you know, in that caramel dipping sauce that comes with the apples. So any other fellow sisters or brothers here who prescribe to my idea of medicine that chocolate is medicine, right? Hashtag chocolate is medicine right there, right? What are some of the other common foods that the brain gets triggered to crave when we're stressed out? Salty foods, sometimes salty and chocolate together. Don't cringe until you've tried a little bit of M&Ms in your movie theater popcorn. I'm telling you, it works. Carbs, fried food. We think of the deep fried butter in Illinois at the state fair. There's always a long line. Cheese and carbohydrate combination, affectionately known as calling the pizza delivery guy, right? There's actually brain science behind why these moments or the witching hour happens. It's known as the stress response, something that Dr. Walter Cannon won the Nobel Peace Prize for in the 1940s at Harvard Medical School, something that we also know as the fight or flight response. But the issue happens is that when our jobs or life is chronically stressing us out, our brain shifts into the stress response permanently, and something known as inflammation occurs. This myriad of chemicals get released in the brains, steroids, other hormones, cortisol level goes up in the body, and all of a sudden, nobody will want to eat carrots without that caramel apple dipping sauce, right? It leads to why we can't sleep well, poor nutrition, and emotional distress. It stems completely from this area in the brain known as the amygdala. Forgive me, my brain is wired abnormally. I happen to think brain science is sexy, so we're gonna have a geek girl moment right here. If you need a break, and you can tweet me at hashtag Dr. Romie and Co-op Summit right now. But I figured it was really important for us to understand the science behind why some of us tend to tip over the edge with stress a little quicker than others of us. That dark, shameful secret I was hiding or trying to hide all those years. This amygdala, connected to the temporal lobe, is known as the airport traffic control center of the brain. It's behind both ears. And anybody know the busiest airport here in the United States? In the world, actually. Take a guess? Atlanta, yeah, in the world. I had the honor of meeting the chief operating officer of Atlanta Hartsfield Airport. And on a clear day, which doesn't happen often, but clear day, there are 120 to 140 flights that go through Atlanta in 1 hour. The airport traffic control center in our brain processes more information than that in 3 seconds flat. It's thinking about, how does the room temperature feel on my skin? I'm sitting on this chair. Oh, I shouldn't have had that last drink on the ferry last night, right? What part of this lecture that Dr. Romie is talking about does my brain need to remember? Encoding our sensations and our memories. But what happens when we go into this fight and flight response and stay there, this whole idea of difficulty paying attention, staying focused, our memory starts to fade. Why, as a very young doctor, I started to feel like I was exhibiting some of the signs and symptoms of my dementia patients. This old adage isn't true, that my memory is fading with age. I have a solution. But let's take a quick check here. How is your personal airport traffic control center doing on a day-to-day basis? If you were come in and see me in clinic in Orlando, we do a large battery of tests and labs. People like to see numbers and measure heart rate variability. But it boils down to these 3 simple questions, because one of the first things to go when the airport traffic control center is off is our sleep cycle. So think about this. Does this pertain to any of you? Do you have difficulty falling asleep because you can't shut off the thoughts? So you need a glass of wine, a beer to take the edge off when you go home. You take a natural sleeping aid, a prescription sleeping aid. Or how about this one? You fell asleep okay with or without the medication, but you pop awake at about 2:30, 4 o'clock in the morning, and you can't get back to sleep. So you're like, let me just send off some emails or do the laundry before the kids wake up, right? Or you may actually sleep the whole night through with or without the medications. You get the doctor prescribed 7 to 9 hours of sleep, but you wake up feeling absolutely exhausted. If that's you, please come see me after this lecture, and I can give you some ideas. Those are the people I worry about the most, and hormone imbalances and things getting missed. So if one of these 3 things falls into place, take a deep breath and know that I'm here to tell you that you can take control of your airport traffic control center.